there, I'm Dr. Greer. I'm a board certified plastic surgeon in Cleveland, Ohio, and I specialize in body contouring. As part of that, my office offers CoolSculpting, and CoolSculpting is a technology that a lot of people have heard of, but don't necessarily know the details of. So today I want to give you some information on what CoolSculpting is, what the treatment's like, what it costs, who's a good candidate, and kind of end with, is it worth it? Because that's a question I hear a lot. Is CoolSculpting worth it? So first, what is the technology? CoolSculpting is cryolipolysis. The cryo means cold. Lipolysis means rupture of the fat cells. So what happens is we chill the tissue down to a temperature where the fat freezes and crystallizes, just like if you put olive oil in the fridge and it solidifies. But it's not a low enough temperature to freeze water, which means the surrounding tissue isn't injured. That fat crystallizing within the cells starts the process of apoptosis. And apoptosis is programmed cell death. So it's a little bit different than just killing cells. With that, there's a lot of inflammation. With programmed cell death, it's a very organized process of your body dismantling the cells and taking them apart, which means there's almost no inflammation. That translates into minimal pain, swelling, and discomfort for you, which is why it's a very cool process. I hate it. The puns always come out with CoolSculpting, so I'm sorry. Sorry about that. So that is what CoolSculpting is. It is the first technology of its kind on the market, and the technology behind it is really pretty awesome and very, very effective. But not everybody gets a great result, and let's talk a little bit about that. With CoolSculpting, you'll see a reduction in about 25% of the fat, but it's hard to translate that into what kind of result you'll get for a couple of reasons. First off, it's only 25% of the fat layer that CoolSculpting can reach. So if the fat layer is thin and CoolSculpting reaches all the way through, then you're going to see a 25% reduction. If it's a thicker fat layer and CoolSculpting only penetrates halfway down, then you're going to see less of a fat reduction. Does that make sense? If it doesn't penetrate all the way. You can overcome that by doing additional treatments, because as the fat layer thins out, the cold will penetrate farther. And I've done that with great success. The other reason it's hard to visualize is because just because something's 25% thinner, what's that actually going to look like in terms of contouring? And that's where you really need an experienced practitioner who has done a lot of treatments and who can tell whether you're going to get a good result or not. Because there's nothing worse than paying a lot of money for something that doesn't work. At our office, we do hundreds and hundreds of treatments. I see all of the consultations myself personally because I want to evaluate whether they're going to get a good result. And if you're not, frankly, I'll tell you. And that brings up the point, who is going to get a good result? Because CoolSculpting is not going to work for everybody. I will tell you that straight up. The first issue is if the fat layer is too thick and the cold only penetrates so far, then you're going to have so many sessions that it just becomes like financially not worth it. It would make more sense to lose weight or have liposuction. So the CoolSculpting manufacturer generally recommends that you be within about 25 to 30 pounds of a healthy weight for your body. That translates to around a BMI of 30. Now that said, it really doesn't matter what your body weight is so much as how thick is the fat in the area we're treating it. So for example, chin, almost anybody can get a great result in chin, even if your BMI is higher than 30. And that's just because the fat just isn't that thick there. I can also have somebody with a lower BMI who really maybe has a lot of fat in, say, the stomach, and they might need more sessions. So it's important for them to know that up front. CoolSculpting is also not going to address any skin laxity. I have a lot of patients who will come in and, want CoolSculpting on their stomach, and the biggest issue is really that their muscles are stretched out from pregnancy, or maybe they've just got some loose skin or crepey skin. CoolSculpting is not going to help with that. It also won't help with cellulite, and cellulite is kind of an interesting thing. First off, I want you to know cellulite's totally normal. Everybody has it. My 2-year-old has it. And it's caused by fascial connections between the muscle layer and the skin, and they just pull the skin down and cause little dimples. It's kind of like tufted upholstery. You don't go and take the stuffing out, you just snip the little band. And that's how cellulite is most effectively treated, by snipping the little band. And there's lots of different ways to do that. So CoolSculpting and liposuction aren't really great for cellulite. CoolSculpting also can only target specific areas. We need a really discrete pocket of fat because it's something where you put the applicator on. You can't blend like you can with liposuction where you can take off less fat. So it works best if there's a not too thick layer of fat, a really discrete area to be targeted and not a lot of extra skin or cellulite that you're worried about. I mean, it's fine if the cellulite's there. It's just the CoolSculpting won't improve that. So you can see it's a little bit of a complex process to determine who's going to get a good result. And that is why you need to go to somebody who does a lot of CoolSculpting. And I think it also helps too if you see a plastic surgeon who does other body contouring, because I can make a recommendation about what other treatments might be helpful, whether that's a tummy tuck or, liposuction, because the blending will be better than with CoolSculpting. So that's my 2 cents on that. What is the actual process like? So the process, of course, starts with a consultation. It's a pretty quick meet and greet. I take a peek, see what I recommend. And as I mentioned before, it's important to me that I do all the consultations in my office personally. And the consultations are all free. We do get your health history, although there are very few contraindications to CoolSculpting. I think if you have, there's only like a couple. Cold-induced urticaria is one of them, and then I don't remember, some other clotting disorder that's induced by cold. Cold-induced cryoglobulinemia, that's it. Otherwise, even with people with Raynaud's, I think it's been done safely, so it's safe even if you're on blood thinners. As I said, very few medical contraindications. We'll also get your height and weight just to track your progress, and then I take a peek at your problem areas and come up with a treatment plan. That treatment plan is almost always 2 sessions a month apart. It's very, very rare that somebody only needs 1 session. And each session can last anywhere from like an hour to an afternoon, depending on how big of an area you're getting treated. CoolSculpting is done in cycles where we put the applicator on, it runs for about 30 to 40 minutes, we take it off and move it somewhere else. So for abdomen, it's usually 4 cycles. Now we have 2 machines, which cuts treatment time in half. So that helps quite a bit. But, plan to hang out and relax. For moms, this is a really good way to get away from your family and have some quiet time. And we give you a little charcuterie box of snacks. We have an iPad with Netflix loaded, which brings a whole new meaning to the phrase Netflix and chill. See what I did there? And you just get to relax. When the applicator is applied and the suction kicks on, it can tug and pinch a little bit, and then it just gets really cold and then goes numb. The actual uncomfortable part is when we take the applicator off, we massage the area really aggressively because that kills more fat cells. That part does not feel nice. When I had it done on my arms, it was like pins and needles and like little shooting zingers. So I won't say it was pleasant. It can almost be a little bit nauseating, but it's literally only a minute, so it's pretty fast. And after that, the area may feel a little bit tender. It'll feel a little sensitive to the touch for about a week, and it will be numb for a month. But, that's it. It's really very doable. I don't think I even took so much as a Motrin. And the cool part of it, again with the cool puns, sorry. The awesome part about CoolSculpting is there is no downtime. I had my arms treated over lunch and then saw patients all afternoon. You could literally leave our office and go to the gym or go swim at the beach. Like no downtime whatsoever, which is one of the huge advantages of CoolSculpting. So we do your session. A month later, we have you come back and we do the second session. And that's usually about when you'll start to see an improvement and notice like a little bit less bulk in the fat. It does take 3 to 5 months for final results though, because it takes your body time to break down and process that fat. And we have you come back for post-treatment photos, usually around the 2 to 3 month mark, so we can track your progress. So that's the whole treatment. Another really important question though is, are results permanent? Our current understanding of fat cells is that they work like little storage tanks. So if you gain weight, they fill up, and if you lose weight, they empty out. But the little storage tanks are still there unless you physically remove them. Liposuction mechanically removes them, and CoolSculpting also physically removes them. It just causes your body to break it down. The company is very cautious in saying, they won't promise that results are permanent. But just because that fat cell is physically removed, I would think that it's logical, it stands to reason that results are permanent. And that's what I have personally experienced. When I did my arms, I then ended up having a 3rd child and was pregnant and gained over 50 pounds. And I could still see where I had treated, there was like almost no fat. I was able to wear some cardigan sweaters that would have normally not fit at that weight. And they fit because the fat was gone over my arms. So you absolutely can tell where the treatment is and that fat doesn't come back. You'll gain it. Other storage tanks will fill up because those ones are gone if you gain weight, but the results will last. So what is the cost of CoolSculpting? Another big question, and of course nobody likes to give prices. I don't know why. I will tell you straight up, if you want to get your abdomen treated, it's going to be around $4,500 to $5,000. It's very dependent on how many cycles There are, and for abs, it's usually about 4 cycles. Waist or hips will be similar. Arms will also be similar. If you're looking at areas like the chin or the inner thigh or outer thigh, that's usually less cycles, so the cost is less. That said, most offices will discount if you get additional areas, and that, of course, is true for us. In terms of price, because CoolSculpting, anything where people try to differentiate on price, I feel like all of the competitors kind of drop to the same level. So CoolSculpting is very consistent across offices in terms of cost. You will find some places will try to reel you in with a deceptively low price. I had a patient once bring me a proposal from another office asking why it was half the cost of the proposal I had given her. And when I looked at it, it was because they weren't doing as thorough of a treatment. They weren't putting the applicator on as many times. Another trick is they may just tell you the price for the first session. At my office, we always give you the total price for the whole treatment. So when you do compare apples to apples in terms of making sure you have 2 sessions, making sure that there are enough cycles of the applicator to get a good result, it tends to be very similar among offices. And that's where the differentiation is really going to be experience and background. And you want somebody who's going to be straight up with you about whether you're a good candidate and who also has the experience to predict whether you're a good candidate. That's why I recommend going to a plastic surgeon, because we've got that experience and background. So to answer the question, is CoolSculpting worth it? You can see it's not a simple answer. It very much depends on how important it is to you to have a non-surgical treatment, what you're targeting, what your goals are, and if you're a good candidate. I hope this explanation has been helpful. If you have additional questions about CoolSculpting, please leave them in the comments. I'll do my best to answer them.